Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM. I'm a cardiologist. We are going to talk about aortic aneurysm, aortic dissection, what causes it, how do patients present with, how do we diagnose, what are the treatment options, and what patients need to know about aortic aneurysm and aortic dissection. I have been a cardiologist at the Texas Medical Center for more than 30 plus years and also in Sugar Land area, and I have dealt with a lot of patients with aortic aneurysm and aortic dissections, and hopefully we can learn something about aortic aneurysms and dissections today. So let's begin. Here is a diagram of the main aorta. As you can see, the main aorta starts at the left ventricle. It arches in the upper part of the chest and becomes the descending thoracic aorta, and it goes beyond the diaphragm into the abdomen as the abdominal aorta before eventually in the groin it bifurcates into the common iliac arteries. The normal size of the ascending aorta is approximately 3 to 3.5 centimeters. And as the aorta traverses through the thoracic region and the abdominal part, the aortic size progressively decreases. As a result, abdominal aortic size may be anywhere from 2.5 to 3 centimeters at the max. What is an aortic aneurysm? Aneurysm simply means thinning of the aortic wall, which stretching, and weakness, which results in a bulging. This bulging could be fusiform, as we see here, or it could be sort of saccular, as we see here in the bottom panel. It is panel C. Let's talk about some demographics. Most of the aortic aneurysms are detected in the later years of life, such as 50s, 60s, 70s. And in the younger population, occasionally we can see aortic aneurysms in people who have what is known as Marfan's syndrome, or people with connective tissue diseases. When the size of the aortic aneurysm goes beyond 4.5 to 4 centimeters, then it becomes critical, because we are likely to see some complications if not recognized and treated appropriately. The aortic aneurysms are classified based on their location and the extension. The aortic aneurysm can involve what is known as the ascending aorta, which is just the part right above the left ventricle, which also gives rise to the coronary arteries. The aneurysm can involve the arch of the aorta, where all the main arteries, the common carotid, the left carotid, and the subclavian arise from the arch. It can involve the descending thoracic aorta, or it can involve the abdominal aorta, most often below the renal arteries. One of the most dreaded complications of aortic aneurysm is dissection, or splitting of the wall along its length. As we can see, here is the main aorta, and part of the wall has split, with the blood leaking from the lumen into this false lumen, creating a choking effect on the main artery, namely the aorta. Michael DeBakey, the chief surgeon at the Methodist, was one of the pioneers in diagnosing aortic dissection, and he has created a classification known as a DeBakey classification, which is used worldwide. If the dissection involves the ascending, the arch, and the thoracic aorta, it is known as DeBakey class 1, which is the most common one, occurring in more than 60% of patients with aortic dissection. The second, less common one, is just involving the upper arch, the ascending arch of the aorta. It can be easily treated with a Dacron graft by resecting the aneurysmal segment and replacing it with the Dacron graft. The intermediate one is the descending thoracic aorta, where there is a tear in the aorta, that is in the thoracic aorta and there is leak of blood into the false lumen. Do patients with aortic aneurysm present, and what are the treatment options available for patients with aortic aneurysm? Aortic aneurysm is usually detected on examinations such as chest x-ray or on a routine CT scan done for some other purpose. It can also be detected by an echocardiogram, which may show an unusually dilated aortic root. If the patients are not having any symptoms, basically we just need to follow these patients carefully and get a repeat ultrasound or a CT scan of the chest every year or so until the size of the aortic aneurysm reaches 4.5 to 4.7 centimeters. At that time, it needs to be very closely followed, and if the aneurysm size exceeds 4.7 centimeters, that's the time to intervene either surgically or by intervention, which we're going to talk about. Here is an example where we have a huge aneurysm involving the ascending aorta, which has been resected and replaced with a Dacron graft. And here's a second example which is showing the same thing, but with the implantation of both the right and the left coronary arteries into the graft if the aneurysm involves the origin of the coronary arteries. This is the different type of aneurysm which is involving the arch of the aorta, where all the main arteries are arising, and for that they use a composite graft which has all the branches which can be connected to these main arteries going to the brain and upper extremities, along with a graft replacing this aneurysmal segment. Let's talk about how a descending thoracic aorta is repaired. There are two different methods that are used these days. Of course, the first one is the old-fashioned surgical approach, where the aorta is split open, and after that a Dacron graft is sutured to the two ends of the aorta, and the flap that was created by opening the aortic aneurysm is wrapped around the graft to provide extra protection, and it is sutured in place. That is the surgical approach for managing descending thoracic aortic aneurysm. Here is a new approach which involves placement of a stent with a graft mounted on it so that you can avoid major thoracic surgery. This procedure is done by approaching the arteries through the groin. A guide wire is passed, and through the guide wire a big catheter is passed. Inside this catheter there is a stent with a Dacron graft, which is similar to the graft used by the surgeons, and this graft is placed in position, and the catheter is slowly withdrawn. As a result, the graft stent expands and it plasters to the wall, thus excluding the aneurysm and creating a more stable lumen at the site of the thoracic aneurysm. And let's talk about aneurysms involving the abdominal aorta. Here is an example of an aneurysm involving the abdominal aorta. It is most commonly known as abdominal aortic aneurysm, or AAA. And if you are in the hospital with this problem, and if you hear the term AAA, they are talking about abdominal aortic aneurysm. Again, if the size of the aneurysm exceeds 4.7 centimeters, then it is time for surgical intervention or vascular intervention. The deadliest complication related to aneurysm, as I already told you, is bleeding. People can bleed massively and can lead to sudden death. Hence, it is very important to first recognize the presence of aneurysm, the degree of aneurysm formation, and finally make a decision for surgical or interventional approach to deal with these aneurysms. Here is a surgical approach. As you can see, the flap has been opened up. A Dacron graft is sutured to this aorta proximally and distally, and after that the flap is wrapped around this graft to provide the extra protection and prevent any further leak. And this is the final picture. And the same procedure is done by cardiac intervention in a radiology department or in a hybrid operating suite. This does not involve surgery. It just involves inserting a guide wire through the groin like we do during cardiac catheterization, and through this guide wire a big catheter is passed, and through this catheter a graft mounted stent is advanced, and slowly the catheter is pulled back. As a result, the graft mounted stent self expands and it creates a more stable lumen inside an aneurysm, and this prevents possibility of blood leak or rupture of an aneurysm. So, ladies and gentlemen, I am Dr. NIK NIKAM, and this is a brief overview of aortic aneurysm and aortic dissection. We just talked about what is an aortic aneurysm and the location of the aneurysm and the age groups it happens, and how we diagnose and manage these patients. The best way to diagnose aortic aneurysm is by CT angiography. I hope this has been useful to you. If you would like to have any more educational videos in the field of cardiovascular diseases, please drop us a note below, and please do subscribe to our YouTube channel and support our programs. And also we have a Facebook page which is NNN Media. We would like you to please visit our Facebook page, like it, and we will see you next time. You have been watching aortic aneurysms and aortic dissections. I am Dr. NIK NIKAM for NNN Media. We'll see you next time. Thank you so much.